Adults and children suffering from certain disorders often take regular medications to try to manage their conditions. However, it's standard practice to take a break from these medications during the summer. It's often called the medication vacation. In today's Eye on Health, child and adolescent psychiatrist Dr. Brooke Weingarden joins us in studio to talk about why that is and also what this is. Thank you so much for being here with us.
Thank you for having me.
So this is actually something new to me. I've not heard of this. What is this process?
Well, I wouldn't exactly say it's standard practice, but it is a very common thing that I get asked about. Oftentimes, people will be on medications throughout the academic year, the work year, and many times, because I see children, parents will ask me if they can take a vacation from their medications over the summer. They don't need their medicine. It's fine. They'll be okay without it over the summer, and they want to take a break.
Okay, so is it kind of like a reset for the body and the mind, or is it just a chance to just quite literally take a break?
You know, I think a lot of people, I don't know if they feel badly that their children are on medication for one reason or another. People sometimes feel a little nervous about medicines, and they feel like if they don't have to take it the entire year round, that maybe it's better. And that's not necessarily the case.
So that's obviously a conversation that you should have with a professional before you start. Is this something that's often recommended, or do you just need to bring it up?
You know, I think it's absolutely right. If you're thinking about taking a break, the most important thing is ask your doctor, because there are situations where, sure, that's fine. If you're on a medication for a particular reason, if you needed a short course of medicine, if it really is just to get through the academic year, then sometimes it is okay. But just like, you know, I like to tell people, just like when you get a glasses prescription, whether or not you're wearing your glasses, it's your prescription, and it certainly helps you a lot more if you have them on. So I often will recommend actually that people will continue to take their medicines, because it sort of keeps the body feeling consistent. It keeps, you know, if somebody has ADHD or anxiety, and if they don't have their medication, they may feel a little more unsettled, out of control, not feel as comfortable, and they actually might feel better staying on it in the summertime.
So it kind of keeps everything level for you.
Right.
So if parents do take their children off of their medications and they notice a change and say, hey, we need to go back, is that an okay thing to do, to just get right back into it? Do you just consult the doctor again?
Usually, yes, but it's always good to just double check, because sometimes if someone's on a certain dose of a medicine, you may need to start a little lower, you may need to ease into it. Oftentimes it's okay to just go back on, but if you're not sure, it's better to ask. One time when I usually will say, yes, absolutely, take a break, is, you know, some medicines have side effects, and one of those side effects can be lack of appetite. And I have some kids that do so well with their medicine, and they're just not eating. And if they really need that time, and if the parents feel like it's not going to be detrimental to them socially or emotionally, it's okay to take a break, maybe to catch up on eating a little bit.
Sure. So something you just said actually led me to my next question. You mentioned the dosage. Could that be a break in itself, maybe just trying to lower the dosage?
Absolutely, absolutely. And sometimes we will do that, where some kids will say their medicine makes them feel a little less social and not as fun, and it really helps them in school or in work or doing whatever sports and because it's not for, you know, for your body.
So Dr. Weingarten, who would be an ideal candidate for this, what we're calling summer break?
You know, most often I get questions about it with kids who have ADHD, because those are medicines that are often in your system in the morning, out of your system by the afternoon. A lot of people associate that with academics, which is not necessarily the case. So I do, you know, encourage that conversation, because while ADHD is a medicine that often you can take on and off, a lot of times if you're a child who's going to camp, or if you're home, or if you're having social engagements or playing sports, you want to still kind of be okay, be yourself with that. You don't want to feel like you're out of control or overstimulated.
Right, absolutely. Excellent advice. I think the most important thing out of what you said, though, is to make sure that you reach out to a professional like yourself before you make any major change.
Absolutely.
Dr. Weingarten, thank you so much for your time.
Thank you.